Hi everybody. Today is February 4th, World Cancer Day. Before we talk of what is or what you should know about cancer, in other words, cancer warning signals, to put it in a simple language, we can compare cancer to an unruly, uncontrollable behavior of a human being. You can say a rogue or a murderer, or even we can say a person who cannot be controlled in any way. This is to compare what a normal behavior is, because cancer has got a pre-stage, most of the cancers. A normal cell can be compared to a normal child with a good behavior. That is, the child, you all know, human being is composed of cells, and each cell has got a cell wall and a cytoplasm, a jelly substance with a small nucleus. This is uniform throughout in a normal cell structure. When it becomes cancer, or if there is a precancer stage, there is an alteration in the cellular cytoplasm and nuclear ratio, and this is the first disturbance which we see. When it becomes an invasive cancer, the cell membrane breaks, the cells coalesce, and they have the behavior, or they develop the behavior of not only spreading locally but also spread to other organs through bloodstream and lymphatics. This is called metastasis. This brief summary, you will be able to understand what a cancer is. So there is also a precancer stage, and cancer doesn't develop overnight. So you should all be familiar with cancer warning signals. There are 7 days in a week, and we all say caution. The first letter of caution spelling is C. This is, we all know, routinely we normally have sometimes constipation or loose motion, but a person continuously developing change in bowel habits, this could be a sign of bowel cancer. That is, alternating constipation and diarrhea or black stools, which is called melena. A person, the second signal is A, caution A. A sore, everybody gets a sore, a diabetic foot or any ulcer, but a sore in which all other conditions have been ruled out and ceases to heal, develops slowly but consistently, it could be a sign of skin cancer. Most important is the unusual bleeding or discharge which any woman can develop, especially after the age of 40. But a person can also get intermittent bleeding after a sexual intercourse, or a postmenopausal women developing heavy bleeding suddenly, or any woman developing intermittent bleeding, and lastly, foul smelling consistent vaginal discharge which may be mixed with blood occasionally. This is the most important symptom for uterine cancer, and every woman should know the signal and take care of her. Next comes breast thickening or a lump in the breast. We all promote breastfeeding. Everybody should know or get familiarized with their breast structure. We say, if you are familiar with your breast, you can detect the lumps yourself first. Most of the cancers, women detect the lumps themselves. Not all lumps are cancerous. There are many non-cancerous condition, or in other words benign condition, there are breast lumps which can occur throughout a woman's life, but sudden skin thickening and lump developing, or a nipple discharge, or in an advanced case, it may be associated with lymph gland enlargement in her axilla and a cauliflower growth in a woman who is ignorant and is in an advanced stage. The cauliflower like growth can occur suppuratively either on the lump, on the breast lump, or on the nipple. Last, the next signal is indigestion. We are all familiar with this. Most of us complain, but not all complaints are symptom of a cancer. A person who has been able to swallow normally, if they develop gradually as difficulty in especially solid foods initially and progressing to even not able to swallow liquids, it could be a symptom of upper GI tract cancer. So this is very important, difficulty in swallowing. As much as we think of bowel habits, constipation, we should also think of swallowing. Next is O, obvious change in a what or a more. This is very important. Many times we think there are sudden crop of warts coming in our body, or some moles suddenly becoming bigger, or a single mole alone can become very big, and even it is called a giant mole. These could be a symptom of skin cancer, and what can be due to human papillomavirus infection. N, the last letter, nagging cough. We are all familiar with an asthmatic cough, a smoker's cough, and a child or anybody recovering from a respiratory infection. This cough is slightly different in the sense it can be a nagging cough, in the sense even with minimal strain the person can develop cough, and sometimes it could be dangerous with a hemoptysis, that is, they cough out blood. This is again a symbol of cancer. It could be these, as I told you, you should have the caution, you should recognize the symbols or the signs and symptoms of cancer. I am not creating a fear of cancer, but I want to impart knowledge of these 7 signals, which not only you should know, but if you find somebody with these symptoms, or if you feel that you could impart this knowledge to people who are unaware, my job is done for World Cancer Day. I dedicated this to my teacher, Dr. Shanta, the Doyen of Cancer. Thank you.